Well, when we think of mental illness, many think of straitjackets in those padded rooms. And though some of those iconic images were accurate at one point in time, they're now things of the past.
Exploring the world of mental health, our Jillian Corder takes us back to the time of the institution and compares medicine of the past to modern treatments of today.
Dark hallways, iron bars on the windows. What we look at now as the scene for the ultimate ghost story was once the ultimate in treatment for the mentally ill. In the mid-1900s, the average sanitarium housed thousands of patients, most in rooms with nothing more than a mattress on an iron bed, each complete with a set of restraints.
They were locked down places. I mean, you didn't just walk out. You know, if you walked out, they came and found you, and they brought you back.
The era of the institution, with a goal to safeguard the public. Those thought to be dangerous were isolated from society.
And they would put them in the hospital, and often they kept them there for long, long periods of time, and sometimes forever.
Movies show overcrowded asylums, shock treatments, and the infamous lobotomy. And though these treatments were used, they've created a distorted perception of mental health.
Electroconvulsive shock treatment, which they still use even today, but it's much, much better regulated.
Today, mental hospitals have reduced their beds from thousands to hundreds. Long-term care cost is thought to be a major factor, but the overall goal of mental health treatment has also changed.
They were thinking about, well, these people have civil rights too. We shouldn't, I mean, if you have to lock them up, well, you're taking away their civil rights. In the, the 30s and 20s and 40s, having people institutionalized for years on end to trying to avoid institutionalizing anyone at all.
From isolating patients from society to helping them rejoin society.
We basically give them job skills that they're going to need to go out and make a living, get out in the community and be able to support living on their own. All kinds of training, whether it be learning how to wash clothes or arts and crafts. We do a lot of art therapy.
In Monroe's Fairhaven, there's only room for 8 patients, with a maximum stay of 6 months.
This is what they see when they come in to our shelter.
Though small, the facility offers the essentials for a person already receiving treatment.
They are referred to us by the Office of Behavioral Health, where they've received diagnosis. They're seeing a clinician. They've got a doctor.
Jackson House is a more permanent facility in Monroe, again with only room for 8. Though the number of beds is only a fraction of what used to be, healthcare professionals say the number of mentally ill is ever growing. The care for these patients has evolved, but that care isn't always accessible.
If you have a person that really needs to have an institution, an institutional placement, you can't find one hardly.
For the hundreds in Monroe suffering from a mental disorder who are not in the system, where do they end up? On the streets for most of them, or behind bars. Those without treatment struggling to see.
It's like being in a mist, like the mist of a storm, a sandstorm. And all your friends and everything in your life are just shadows in that mist.
Feeling trapped by their own minds in the storm that is diagnosed as mental. Jillian Corder, KNOE 8 News.
And next week, Jill sits down with some of those patients who are suffering from schizophrenia who speak candidly about their illness.
Our special reports Mental continue next Thursday at 10 o'clock. Last week, we began our look at the state of mental health throughout the state of Louisiana, comparing treatment of the past to modern medicine of today.
But what does it actually feel like to have a mental illness? Well, to know that, we have to talk to patients themselves. In the second part of her 4-part series, our Jillian Corder sits down with those diagnosed as mental.
What do a 58-year-old from Tallulah and a 27-year-old from Costa Rica have in common? More than you'd think.
It felt like I was going through hell and back.
It was difficult for me to regain my health.
Both Mary Jones and Joshua DeBosch suffer from mental illness, both diagnosed as young adults.
I was diagnosed with bipolar disorder 2, type 2. In 2006 was the year that I was graduating high school.
I've been suffering all my life, but when I was coming along didn't nobody understand about schizophrenia and all these different mental problems.
Mary says before she was diagnosed with schizophrenia, her family thought she was just an unruly teenager.
I just suffered with it because they just thought I was just acting up.
She and Josh have both had to deal with the stereotypes that come along with being mental.
It's a very great misconception that people have, along with the mental illness, straight up in a jacket.
But Josh says there's no straitjacket in his closet at Jackson House, Josh's new permanent home. Mary calls herself lucky because she lives with her family and comes to the Monroe Area Guidance Center for the day program. But not every day is easy.
I was hearing voices. I didn't understand. I stayed frightened and scared. Voices, it don't be nobody you know. They just be voices talking to you in your head, telling you what to do to yourself and what to do to other people sometimes.
A smoke cloud, that kind of mist. And all your friends and everything in your life are just shadows in that mist that you cannot bond or trust. Towards the end, past halfway, it gets clearer. Some of those shadows become your friends. Some others become your enemies.
With medicine and therapy, Mary and Josh say life is easier to handle.
Them voices gonna never completely go away, but as long as I'm on my medication, I can handle them.
And through the storm of being mental, things are getting a little clearer. Jillian Corder, KNOE 8 News.
And next week, Jill looks at the role law enforcement plays in the world of mental health and the challenges that they face. Our special report, Mental, continues next Thursday at 10 o'clock.
Certainly, they've come a long ways in that treatment. Beginning 2 weeks ago, we looked at the mental health treatment of the past and present. Now, last week, we heard what it feels like to suffer from a mental illness.
And tonight, our Jillian Corder looks at the role law enforcement play in handling these patients as part 3 of Mental continues.
We've seen tragedy strike across the nation, and even in our own backyard,
with the intent of taking hostages.
when those that suffer from mental illness break.
He had voices in his head. Of course, one of the demands was he wanted to have this device that was implanted in his head removed.
When those that need help aren't getting treatment, or that treatment isn't enough, some people act out, commit crimes, or do the unthinkable.
He had a small handgun that he was trained on the 2 individuals. He shot both of them as we were entering the building.
If treatment isn't pursued or isn't accessible, who's left with handling those that aren't in control of their own minds?
Who's kind of left holding the bag on this thing? Law enforcement, public safety. I mean, we're a 24-hour-a-day, 7-day-a-week operation. And let's face it, generally speaking, we're here to keep the public safe and we're here to keep the peace, but our job is not specifically dealing with folks with mental health issues. But we have found out that we are having to assume that role more and more.
Across 12 parishes in Northeast Louisiana, police are training to handle mental health emergencies.
The police, the people that are out on the streets, or if you're the first responder to a situation at the mall, you're going to have to be the negotiator to start with.
We're very effective at what we do. We can de-escalate people, we can solve some issues, we can make the immediate problem go away, but it always leaves us with this question here. What do you do with them after that?
After a crisis situation or even a petty crime, suspects are charged and they can be transported to one of 2 places: a hospital for emergency mental health treatment.
We got 1 hospital, 26 beds, serving 12 parishes.
Or to jail. In Ouachita Correctional Center, more than 60% of inmates are on psychiatric medication.
Started closing all these mental health institutions. At that same time, you've had a 300% increase in prison population. Well, take a guess where that came from. They've closed down one institution and moved it to another,
putting those that need treatment behind bars.
So now you're tying up jail bed space with mental health people. And I don't think that was ever designed to do that.
Once they're back on the streets, in some cases, their time spent with law enforcement is far from over. Jillian Corder, KNOE 8 News.
And next week, Jillian looks at the options for getting help and the challenges many face trying to find treatment for themselves or for others.
Over the past month, we've looked at the state of mental health in Louisiana, what it feels like to live with a mental illness, and the role that law enforcement has.
Tonight, in the last of her special reports, Mental, our Jillian Corder examines how someone would go about getting treatment and the struggles they may face.
When suffering from a mental illness or living with undiagnosed symptoms, getting help should be a top priority.
It's no different than cancer or diabetes or anything like that. I mean, it's something that needs to be treated, and if it's a chronic mental illness, it's something that needs to be treated sometimes for a lifetime.
But for some, no matter how much you want help, it's not always within reach.
But unfortunately, because of the state cuts and the budgets in our government, it's very sad is that this is an underserved population and that we've kind of let go to the wayside. And so it's really hurt them, and it's turned into a revolving door of them kind of going either in and out of jail or in and out of short-term psychiatric facilities.
We got one hospital, 26 beds, serving 12 parishes.
And for places like Fairhaven and Jackson House in Monroe, you must already be in the system to receive any help.
They are referred to us by the Office of Behavioral Health, where they've received diagnosis. They're seeing a clinician. They've got a doctor.
Well, if they don't have the proper funding, Medicare, Medicaid, or if they're not already in the system to get the help that they need, then a lot of times they can be turned away.
Another hardship facing families is attempting to get treatment for a loved one that doesn't want it.
Well, convincing it is a difficult part. I mean, that's when it takes the family, it takes the caretakers and the mental health professionals to let them know, to show them the signs, show them what their behaviors, what their actions have done, and show them the consequences of it.
But for those that don't recognize they have a mental health issue, options are limited and situations can turn tragic quickly.
You can get a coroner's exam and get them put into a hospital against their will for 72 hours.
I mean, after those 72 hours of observation, and if they still need some kind of help, but it's not requiring acute care or immediate help right then they can be let go. And that's to the streets, home, or wherever, and they still need the help.
Though few would argue that institutions of the past were perfect, it did give many a place for treatment who may have nowhere to turn for help now. And as we've heard from Joshua Dobosh,
I'm a success,
who will live in a facility for the rest of his life, living with a mental illness isn't always debilitating.
There are government programs. There's a lot of caring people that have the patience to put up with you at the beginning.
It is a struggle that no one should have to face alone. Jillian Corder, KNOE 8 News.
And all 4 parts of Mental can be found on KNOE.com, along with information on how to find treatment in the area.